Hi, how you doing? Hope you're doing well. It's been a while, hasn't it? I think last time I uploaded a video was in 2021, beginning of 2021. So it's been almost a year. Hope you're doing well. Happy New Year and happy Lunar New Year also. So let's talk about today's topic, why I decided to get back to school and get my Master of Health Administration MHA degree during the pandemic lockdown. So quick backstory, I've been working in the healthcare field for about a little bit more than 10 years now, mostly on the clinical side. So I was an EMT, work on ambulance, then trauma hospital, psychiatric hospital, then spend a little time working with kids on the spectrum for the mental health field. And now I decided to, you know what, I want a new setting, new environment. So I decided to, you know what, let's pivot into the management administration route and see how it is. So during the pandemic lockdown, there's a lot of stuff going on and I was busy helping my parents running errands. Because of that, I was saying, you know what, let's take a break from work and go back to school, which is why I decided to pursue an MHA degree, because I already have 10 plus years of experience on the clinical side. It just makes sense to do a Master of Health Administration. Initially, I was thinking of doing a Master of Public Health, but I rather gear toward more administration, management side than public health, because honestly, I don't have any public health experience, but I do have a lot of hospital and management experience, more on the operation and project side. So therefore, it makes more sense to go into the Master of Health Administration. So what is a Master of Health Administration, MHA? In short, think of it as an MBA, but geared toward healthcare. So there's a lot of stuff you could do with MHA. There's a lot of department that you could go into as an MHA grad. So for example, let's say you get an MHA, you could go to finance of the healthcare hospitals, the hospital, a private healthcare company, and you do their revenue cycle, billing, insurance, or the financial side of it. Or you could go into marketing, public relation. I know some people that got an MHA, but they're more geared toward tech side. And if they have bachelor around tech, computer science, they could go the informatic, is it IT route or informatic healthcare route. And they could do that also. So there are many ways you could use the MHA degree. So why did I choose MHA instead of PA school, nursing school, or med school? Honestly, it's the ROI, the return on investment, and how long it takes. If you know, my roommate is actually a doctor now. He's doing his residency at UCLA, but I live with him, so I know how tough it is to become a doctor. So we both went to UCLA. He went 4 years as a neuroscience major. Then he did 2 or 3 years of clinical research before he got to med school. 4 years there. And now after he graduated from UCLA med school, he's going to do another 5 years as residence for his resident. So overall, he's going to spend about 16, 17 years to become a doctor. I mean, yeah, sure, you make good money, but that's a long route. And most time he's in school. Most time he either at home studying or he's doing his internship, residency. So it's a lot of work. Same thing with PA. Yes, PA you have to do 4 year undergrad, 4 year, another 4 years at the in PA school. Actually, no. I know some PA school is only 2 years. USC is 3 years because they require you to do some other stuff. So it's not bad, but initially PA school was my plan B, but right now I just want to try out different things. And nursing is not nursing actually is a good idea, but it's overall PA school, nursing school, it's a cost, right? I think overall it's going to be above $100,000 to either go to PA school or nursing school. You know how much I got from my MHA degree? And it's only about what? I think 35 to 40K. I mean, I think around 36,000. That's why I paid for my MHA degree. And I also did an accelerated program, which including the summer school. So I finished in about 1.5 years. And right now I'm already done. I got my master and I'm already working in the field. So it's just return on investment. It makes more sense for me to go the MHA route and then start working in the management side, admin side, and slowly work my way up compared to my peer. Again, I have friends who are nurse, who are doctor, and who's pharmacists, all those stuff. It's a lot of schoolwork. And when you get older, honestly, during the last year, that's one reason why I don't upload much during last year, because it's a lot of work. And schoolwork, you get tired of it eventually. Like, I don't know if I want to go back to school anymore. So that's one reason why I decided to go back to school for MHA program instead of nursing, PA, and med school. So final thought, what's your thought on MHA degree? Like, I'm fairly sure you click on this video because you are curious about Master of Health Administration. Is it worth it to pursue it? Honestly, it's up to you. Like, what do you want to do for your career? Do you want to become a manager in a hospital or healthcare company? Do you want to work? Because here's the thing, in healthcare, it's about experience. Yes, degree will help you get your foot into the door, maybe for interview, but doesn't guarantee you a job. I want to make it clear. A degree does not guarantee you a job. It's helped you get an interview for sure, but it's about your interview skill and your history, your work history, your experience, and your skill set that you could bring to the company or to the hospital. So personally for me, I have 10 plus years of clinical skill, and I have worked in a hospital, multiple hospitals. So it makes more sense for me to get an MHA and then slowly get transition over to administration and management side. But for you, I don't know exactly what your history is. If you don't have any work history in healthcare, I might hesitate to recommend MHA degree unless you want to do MHA route and then also during your program, get an internship or get some work experience during your program so you could have experience. So by the time you finish your program, you could start applying to a job. Like personally for me, I already got a job before my program ends because I have my work history and my experience. So that's why I really want you to reconsider choosing MHA unless you have the experience, you have work history, or you are willing to get an internship or some type of work experience during your program. Because again, a degree does not guarantee you a job. Your work history, your work experience will. Well, I hope you learned something new from this video. What is your thought on MHA degree? Will you consider it if you want to go into the administration and management side of the healthcare field? Let me know down in the comment. And like and subscribe. On this channel, I talk about my experience working in the healthcare field, and I also talk about any healthcare or any topic in the healthcare field that I think is important. So I will see you again on the next video. Take care. Bye.